It's another day with the physicians where your health is our business.
Growth spot the end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know is
You're welcome back to the Training Culture of your regular program.
Your blood level of cortisol, which is one is a hormone, it rises, and when your cortisol rises, your BP then rises. When it does that, your sugar level increases, and when your sugar level increases, you have diabetes.
Glaucoma is a chronic, progressive, degenerative disorder of the optic nerve. Glaucoma is the second cause of blindness, and importantly, it is irreversible. It is estimated that around 80 million people have glaucoma worldwide. The World Glaucoma Week is aimed at raising awareness on glaucoma through a series of engaging worldwide activities. Patients, eye care providers, health officials, and the general public. The goal is to alert everyone to have regular eye and, of course, optic nerve checks in order to detect glaucoma as easily as possible. On your favorite health TV talk show, The Physicians, we shall be discussing The World is Bright. Save your sight. It's another day with the physicians where your health is our business. My name is Dr. Martina Agberian, your regular host on this program. We shall be discussing The World is Bright. Save your sight. I'm not alone on this program. With me, as usual, is my very eloquent, elegant, beautiful co-host.
I remain Dr. Memuna Yusuf Kadri. It's always a pleasure to be on this show.
Now we're going to be talking about The World is Bright, Save Your Sight.
Exactly. Why are you wearing glasses? I remember when we started, you used to pride yourself that I can see. I can see.
Remember that, yes, it gets to a stage in life where you just have to accept some things that are just natural and normal.
Really?
It actually comes with
so
aging.
Wearing glasses is natural and normal?
No, the truth is, what happened on this particular day, why you see me wearing this now, on this evening, I just woke up to get a call, and lo and behold, I started seeing
stars.
Not even stars, flashes of light. It was like this pen touch kind of light, and we're just going. I said, what's going on here? I kept using my hand to take it off, but it wasn't leaving. So I said, what's happening? In the dark. So I stood up, and as I was walking, I could see the thing was following me. Then next thing I started seeing things like feather. I kept doing that. I said, what's happening here? So I called my husband and said, see what is going on. As I was moving, it became like fire was moving, the thing was moving. I just kept doing it will leave. It never left. Then I now placed a call to one of the consultants, ophthalmologists. And she said, I think you have a detachment. Memuna, I couldn't sleep. Say, I probably have after I telling her all my symptoms, I need to come to the hospital because it's a medical emergency. And that was how I found myself at Lagos University Teaching Hospital. They did all the investigations and everything. And really, there was actually a detachment. But the beauty of it was that it's not a retinal detachment. If it was the retinal detachment, then that would have been a bigger problem. So, and they advised me that I should ensure
you wear your glasses. Medical conditions are really, for me, they are debilitating.
Actually, well, we have a guest that is going to talk more on our topic. The World is Bright, Save Your Sight. We'll be back after this short break. Stay tuned. you have just joined us, you're on to your regular program, The Physicians, where your health is, of course, our business and will always be our business. Today we'll be discussing a very, very, very important topic that has to do with glaucoma. And we're using the World Glaucoma Week theme for us to ride on. It is, the world is bright, save your sight. The world is bright, save your sight. And in the studio with me, we have a very important guest. He is a consultant ophthalmologist, Dr. Festus Oshoba, and the MD CEO at LADKEM Eye Hospital here in Lagos. Doctor, you are welcome to our program.
Thank you.
You're welcome, sir.
Host and viewers at home.
I just admire the way you are holding on to
No,
this.
no, it's not holding. It's hugging it. You're hugging the eye.
Yes.
And the eye is looking at us.
Well, so we're going to be talking about the world is bright, save your sight. That has to do with glaucoma. And maybe you want to tell us the general view. Tell us something about the eye first so that you can understand it. Maybe you give it a general view of the eye itself. Then you now tell us, narrow down on glaucoma.
Thank you. Let's first go spiritual and philosophical. And we normally say the eye is a window to the soul. And as physician, we also say the eye is the window to the body. Because through the eyes, we can actually, the ophthalmologist can look through the eyes and see diseases like hypertension, diabetes, high cholesterol, so many things we can detect just by looking inside the eye. And if we look at even the human body, the input to the brain, about 80% of the information that goes to the brain comes from the eyes. So, and the eyes contains about 10 billion neurons or nerve fibers. So which means that the good Lord really wants us to use our eyes so that we can be able to adapt to our environment. And the key thing here is that all over the world, especially in Nigeria, what are we talking about? Poverty. So we want to increase our GDP. We want people to be more productive. So how can you be very productive if you cannot see? So we really need to encourage people to see well, because seeing well now is very important. 2023 election is very nearby. So you want to choose the party that will represent you, that will carry you along. We need to shine your eye and see the ballot board very well so that you can thumbprint you how you want to be. And then also, we see that the world is truly beautiful. So we need ourselves to protect our sight so that we can see the beauty in the world, and so that also we can generate happiness within ourselves and then be more productive and make the world and Nigeria a beautiful place. It was said that Nigerians were the happiest people on earth, but today the story has changed. So the theme of this makes sure that at least let us see well so that we can be happy. Okay. So this is very important. Also for the eyes, that the good Lord are giving us a pair. The eye of the human being is similar to those of the other mammals. So for us, we need to ensure that we protect our eyes. And how do we protect our eyes? General hygiene, from food, from washing our face very well, from also checking our sight by covering one eye at a time, and looking at an object, maybe in our house, maybe a calendar, and see, oh, this calendar, I was able to identify these alphabets yesterday. Can I still see it today? And then if we have complaints like dew-like vision, or things becoming as if there's harmattan, as if things are hazy.
I think before we won't even dive into all the...
Yes.
Because people, we want to understand certain things that they are going through before the protection and all. Protection is awesome. I love the fact that you're already giving us what we need to do and how we need to do it. But this week has a theme. The world is bright.
Save
your sight. Yes. Let's nip that on board, because the way you started with the eye is the window to the soul. The eye sees, with the eye you can detect thousands of medical conditions. So let's elaborate on the theme for this week, so that people will understand the beauty behind that theme.
Okay, so using that's your model. Where does the light pass through? What just
exactly? So if we look at the eyeball, it's shaped like a ball, like football.
Yeah.
So the front 1/3 of it, this part is like the glass of the eye. The light has to enter through here, and then there's another lens in the eye, passes through there, and then to reach the retina, the back of the eye. So the eye has 3 layers. We have like the skin layer, then the food layer, and then functional layer, which we call the retina. So, and this is the one which we used to see. So when the light passes through the front of the eye, the glass of the eye, it enters.
Is that a name to that glass of the eye?
It's called the cornea.
Yes. Okay.
The cornea. Then inside we have the brown part, which is the iris. The whole inside is the pupil, which controls the amount of light that enters the eye. And then the light is bent, and then until it focuses. And then after focusing on the retina, at the back, we now have the nerve fibers coalescing together to form like an electric cable.
Okay.
We call it the optic nerve. Okay. This nerve connects directly to the back of the brain. And then so any image that you see is actually sent to the brain as for interpretation. So that along the line, there can be problem with the eyeball or with the nerves or with the brain. Because somebody can have bleeding in the brain, and because of that, he does not see, not because there's a problem with the eyeball. So therefore, the eye is something that God has designed in a very special way so that we can see the beauty in our environment and be able to situate ourselves and adapt and be the best that we can be for ourselves and for our society and our community.
Okay, so we're talking about glaucoma.
Yes.
God is the word glaucoma.
Yes.
Okay, so we're talking about glaucoma.
Yes.
God is the word glaucoma.
Yes.
Okay. So what actually is glaucoma?
So glaucoma, when we are talking about glaucoma is a group of diseases. And I'm going to explain glaucoma in the layman's language, especially in the way that Nigerians will understand.
Yeah, better.
So for us in the medical field, we say that glaucoma is a group of diseases that affects the optic nerve and produces loss of vision if it's not attended to. So with this glaucoma, what happens? My father-in-law had glaucoma, and he told me when he came to my clinic, he said, "Doctor, there was one man that we fought together. The man pointed the finger at my eye, and after some time, I wasn't seeing well." So people feel that when they are not seeing, it's because of evil spirits, it's because of people that are. But in glaucoma, we find out that the eye is actually looking very normal. So in Yoruba, you just say, so the eye is open, it looks normal, you cannot see any abnormality, and yet the person is not seeing. The person is bumping into objects. Whereas in cataract, you will see something white inside the eye. Sure. So people, some other diseases, you can see redness, you can see in corneal diseases, you can see scars. But in glaucoma, the eye appears normal. But what just happens is that the person is bumping into objects, is not seeing well, is having accidents on the road, and is actually not aware. And that's why we say that glaucoma is the thief, is the silent thief of vision. So anything that gives you pain, redness, discomfort, will make you run to the hospital. In glaucoma, really, there's no symptom. And so we say that the solution to glaucoma is early detection. So if you have a family history, like somebody was blind in your eye, in your family, and is not seeing well, your siblings and so on, especially in the black race, and also even in the eastern part of the country, all the tests that have been done, surveys, epidemiological surveys, shows that glaucoma is real. It affects peoples all over the world, and it's a cause of blindness, but it can be prevented.
We need to get out there and check out what you have to say about keeping up with the physicians. When we come back, we'll discuss more on glaucoma. Stay tuned.
No, I have not.
I do use recommended glasses, but the one I'm putting on now is a sunshade. As you can see, during the sun, I use it to, help me reduce the sun to my eye.
I go for checkup 2 times a week.
It's more than a year now.
I had my eye checkup on Tuesday, and it's not. There's actually no reason for it, but because it's something I do regularly right from when I was small. Because I used to have this eye itching problem, but instead of the glasses, the doctor recommended some drugs and some eye drop for me to use. So I go there for checkup every Tuesdays and Thursdays.
I always protect it, like as you can see now. I do use this sunshade now to maybe if I want to enter a bike or so that the breeze will not enter my eye. Well,
you try as much as possible to stay away from bright lights, and the phones we use nowadays, there's this the brightness that comes from the phone is actually always small. That's why there's something they call eyelid that changes the brightness of your phone. It helps for the eyes also, and there's the glasses too.
In fact, since I've been entering public buses, I've never seen any driver using high glass. The reason is, even if he has a eye problem, he's using glass. Most people will not want to enter the bus. Or if he dare use the glass, something happens. Yeah, don't you see he's using glass? He's not seeing well now.
Well, I can't say they are perfect, but for me, I've never seen anyone drive with glasses before.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. In the studio, we have our guest, Dr. Festus Oshoba. He's actually been talking about glaucoma and that the world is bright, save your sight. He has given us a whole lot of information and talked about the components, things that actually can cause glaucoma. And he did mention the intraocular pressure, the visual field, how you're able to detect that, and a whole lot. So we need him, and he said it can even affect both eyes. So we just want him to tell us more about the effects of glaucoma on the eyes. Dr. Oshoba, you have the floor, please.
Thank you so very much. So, as we said that the glaucoma can affect both eyes, usually affect both eyes, and starts from one eye. And the main symptom that people have glaucoma, the thing is that majority of the cases there's no symptom in the early stages. So the only way you can know is just to go and see your ophthalmologist, and then let's check your eye pressure, let's check your visual fields, let's do some other tests, and then we can detect it. Especially if there's a family history. If your parents or anybody in your family has been blind, you don't know the cause, go to the hospital and check. Very, very important. The next more important thing is that there are so many causes of glaucoma. For example, injuries can cause glaucoma. We call it secondary glaucoma. Okay. So if you flog somebody and there's bleeding in the eye, it will cause glaucoma. If somebody has cataracts, it can cause glaucoma. If somebody has diabetes and so on, some other conditions can cause glaucoma. In fact, inflammations and tumors can cause glaucoma. So from this, we see that a person may have a breast cancer, it may spread to the eye, and then it will cause glaucoma. So in glaucoma, the symptoms will be no symptom at the early stages, then misty vision, hazy vision, harmattan-like vision, dew-like vision, bumping into objects. There was an experience from one of my senior ophthalmologists. He was driving at Ilori, and somebody actually hit his car. He found out that the person that hit his car was his patient that had glaucoma. He didn't see the vehicle coming. So this is one of the causes of road accidents. That is why our eyes are so very important. There are so many eye care centers. You need to visit one and check your sight. Then a child can be born with glaucoma.
Really?
So you need to ensure that your pediatrician sends you to see an ophthalmologist to check your eyes and see whether that child has a potential. In fact, some children are born with glaucoma, and you can see that the eye is like that of the eye of a cow. You know, it looks very big. So when a child is born with very big eyes, it may just be that this child has been born with glaucoma. And if something is not done at that early stage, like surgery, the person goes blind. So in glaucoma, the most important thing that you can do as a person at home is get a calendar in your house. Put it on one of your walls. Every morning or every evening, whatever you have the chance, cover one eye at a time. Read the letters that you can see. Any day you notice that the letter you were seeing last week, you can't see it today, this is alert, emergency, and action. Because the broad is bright, you need to save your sight.
Okay. Before I let you go, just two prompt questions. For the eye care, how often should people do their eye checks?
For glaucoma screening, if you are normal, there is nothing wrong with you, once a year is perfect.
Awesome.
For those who have family history, at least twice a year. And then those who have glaucoma will have to be monthly.
Okay, then how about any dietary information, the food that they need to take?
Lifestyle, anything on the lifestyle that can help them.
Yes, the most important lifestyle, as I mentioned, is injuries. Injuries can cause glaucoma. In terms of food,
so you avoid anything that can
give injury. And then when you are in your house, you want to take something from high up, be very careful so that it doesn't hit your eye. Or if you want to take something from below, make sure your eye doesn't hit the table or hit something. And we are protective. Dr. Agbere has joined us. I hope Dr. Memuna will join us soon.
No, there's not this. No, don't host anything. You are on your own, both of you.
Well, I'm okay. I can see very well.
I can see very well.
And I can drive. But before I end, I say I can drive very well. Have you really seen drivers, commercial drivers, with their prescribed glasses?
Well, some of them do, some of them don't. For the Federal Road Safety Corporation, before they give you a driver's license, you're actually supposed to do an eye check.
Do they do it?
But a lot of the time, they don't really care so much about this. People are giving their driver's license without actually having their eyes checked. This is a danger to themselves and other road users.
But for the downfall drivers, I don't think I've seen any.
I've never seen.
I've never seen. So you think that their eyesight are just perfect?
It may not be. It's just that I think maybe the stigma, because if you see your downfall driver is wearing glasses, and then you want to enter the vehicle, you're like, this one that is wearing glasses, before you go and throw me into Third Mainland Bridge, I'm not going to enter. So maybe it may just be a myth. Maybe that is why, even if they are not seeing well, they are, they are not wearing their glasses. But it's a concern for me. Because they can't all be seen well.
Absolutely. I think we need to do something about that. Final words for
our viewers at home.
Well, the final word is this. You have your doctors, but you have to be your own doctor as well. So food that help the eye nutrition are food that are rich in vitamin A, green leafy vegetables, palm oil, yellow fruits, milk, egg, and some food substances that we take now are fortified with vitamin A. So, with this, good nutrition of the eye makes sure that the eye gets nutrition for you to see very well. Protect your eyes from the sunlight by wearing either glasses that have UV protection or recommended glasses. Avoid injuries to your eyes. Check your eyes at least every other day by looking at the calendar in your eyes. And see your doctor when you are not sick. Prevention is surely better than cure.
I totally agree with you. And Dr. Oshoba, thank you so much for coming on our program. Actually, we have benefited a whole lot, and I'm sure our viewers out there have actually benefited so much. I'm sure when we call again, you will please avail yourself so that you can do another very, very interesting topic. Thank you for coming on our program. I remain Dr. Martina Agbere. Till next time, stay blessed.
Thank you very much, sir. This is very exciting, and I like the way you ended it with the, save your sight. Election is around the corner, so you can see your candidate's name well and ballot boxes well and thumbprint where you're supposed to thumbprint. Please don't forget to follow us on all our various social media platforms: Twitter, Instagram, YouTube, Facebook, And if you want to be a part of this, our regular and favorite TV talk show, The Physicians, you are just a click away. Just send us an email. I remain Dr. Memuna Yusuf Kadri. Till next time, remain blessed.
My name is Doshima Bahabo, a community health nurse specialist. I just spoke about rape and told us how traumatic it is and how stigmatizing, unfortunately, for victims who are being raped. We need to support them in their communities and encourage them to speak out. Watch The Physician periodically or whenever the show is on. I love it because it gives a lot of health tips. Thank you very much.
Knowledge about cancer is still not so much. Not until somebody dies of cancer and then we begin to hear that, oh, this person died of this cancer or that cancer. It is at that moment that some people, get to know that, oh, indeed there is something called cancer.